But how do those all interact together? COVID, mental health, and tobacco use. And what is the connection with racism, including institutional racism? Is this in fact a syndemic for each individual, or is there a role that, for example, racism and inequities has played as a core syndemic? We are going to begin to explore some of these issues. We are not going to necessarily get to all of the results. This is the beginning of a conversation that we hope to continue over a period of time. But we're really excited about having two very well-known researchers and a discussant to help share some thoughts about how this interaction may take place. So at this time, I'd like to introduce our two presenters. First off is Dr. Janice Tsoh, who is an associate professor of clinical community psychology at DePaul University. She conducts community-engaged participatory research with Asian American immigrant and refugee populations to promote health and mental health through culturally responsive interventions. She's particularly interested in how structural, community, and social cultural factors shape coping and health behaviors, and how we can design and adapt behavioral health interventions to improve health and mental health outcomes for Asian American communities. In 2017, Dr. Tsoh was awarded an Early Career Research Award from Asian American Psychological Association for her distinguished contributions to the field of Asian American psychology. We are also pleased to have Dr. Janice Tsoh, who is a professor of psychiatry and behavioral sciences at the University of California at San Francisco, and is a co-director of the Asian American Research Center on Health. Dr. Tsoh has over 100 peer-reviewed publications, and her research, funded by NIH and the California Tobacco-Related Disease Research Program, has focused on reducing tobacco-related health disparities in vulnerable populations. Dr. Tsoh is a principal investigator of the Healthy Family Project, a community-based health promotion project that has provided lifestyle education interventions to more than 1,200 individuals and families in Chinese, Korean, and Vietnamese languages since 2012. So please join me in welcoming first Dr. Janice Tsoh.
Good morning or good afternoon, everybody. I'm really pleased to be here and so grateful to Rod for giving us this opportunity to have this conversation around mental health, smoking, COVID, and racism. A lot of what I'll be talking about is based on a project that Dr. Tsoh and I, along with other researchers across the country, are involved in, which we don't have a great name for. We call it the AAPI COVID-19 Needs Assessment Survey. In this survey, in the study, we have surveyed over 3,700 Asian Americans. Part of our group includes Native Hawaiian and Pacific Islander partners. And so we have a parallel study with them as well. I'm just going to present a little bit from the Asian American side of the survey. And we tried our best to get at both coasts, as a lot of Asian American research does, but also to recruit Asian Americans in the Midwest and South. And so we've got a really great sample of Asian Americans who we surveyed between January and April of this year. Along with that, we conducted a follow-up survey with the Stop AAPI Hate Reporting Center, and so I'll present some of our data with them as well. First, no new news for you all. Like all of us, the current pandemic is profoundly affecting our lives. In our study, and certainly I'm sure all of us can relate, many Asian Americans are experiencing disruptions to education for themselves or their children, lost jobs, lost income, disruptions to social and religious activities, increased family stress. And something which I'll be talking about today is the increased discrimination that Asian Americans are facing during this pandemic. Asian Americans are also facing a multitude of stressors, mental health concerns, stress related to having to social distance or quarantine, physical health concerns, sometimes related to healthcare access difficulties, financial concerns, impact on family and work, and certainly the stress of discrimination. A lot of these stressors are not new. We know that Asian Americans represent both the most well-off and the least well-off among Americans. And so some of these concerns are magnified during the pandemic, and some of them are new. Social distancing certainly is a stressor that is new to all of us in the context of this pandemic. We also know that these stressors are not experienced uniformly across Asian Americans, who are already a very diverse population. Young adults tend to have more stressors than older adults. Women and non-binary and trans individuals tend to have more stressors than men. And of course, those who are lower income are experiencing more stress than those who are high income. On top of all of these concerns, one thing that we have certainly been talking a lot about in this past year are hate crimes and other anti-Asian racism that started really around January. These reports of discrimination and violence towards those who are perceived, not even having to be, but perceived to be Chinese or Asian. We all know that hate crimes have been on the increased about 150% since pre-pandemic. And our partner, Stop AAPI Hate Reporting Center, has logged over 3,800 hate incidents between March of last year and February of this year. And what we are hearing in our follow-up study is consistent with what folks have been reporting through Stop AAPI Hate, and also what has been gaining media attention as well. So here are some examples of what folks are reporting: being called racial slurs, being coughed or spat at, physical violence, and these are sometimes overtly racial or racialized, and sometimes connected explicitly to blame for the current pandemic. What we're finding is that Asian Americans are fundamentally experiencing a loss of safety during this pandemic because of the racism and xenophobia that they're experiencing. 95% of folks reported to the Stop AAPI Hate Reporting Center and then followed up with us are reporting that they now feel that the US is less safe for Asian Americans. We are also seeing a connection among Asian Americans, really attributing a lot of this rise in anti-Asian racism to political rhetoric that Trump and others have ratcheted up since the start of the pandemic towards Asian Americans. But this doesn't, what we're seeing isn't solely based on folks who have experienced hate incidents and gone the extra step of reporting these hate incidents to Stop AAPI Hate. We're seeing this among our needs assessment sample as well, who may or may not have experienced hate themselves. Fundamentally, racism and the increased racism that Asian Americans have experienced has led to a loss of safety and the belief now that the US, their country, is more physically dangerous for Asian Americans, and that this has been attributed to political rhetoric. We've also seen an increase in the amount of cyberbullying against Asian Americans, and that's been reported as well. Could you advance the slide? Thanks. And as I was mentioning, these perceptions of racial discrimination obviously are heightened for those who have experienced discrimination and gone through the extra step of reporting it to an online reporting portal. But you can see here that there are high rates of different types of racial discrimination that are experienced in both of our samples, the heat respondent sample and our national sample. You can go ahead and advance the slide. One criticism might be, and it was something that we originally thought about, was whether racial discrimination is something that is more apparent or something that English speaking or US born Asian Americans are more aware of. But as you can see from this slide, those who took our survey in an Asian language, so probably less English proficient Asian Americans, less proficient Asian Americans are also perceiving racial discrimination. And what you can see here is that, which again is a surprise to us, is that 54% of those who took our needs assessment survey in an Asian language have been cyberbullied because of their race or ethnicity. And this is actually much higher than those who took our survey in English. So that's surprising to us. And so racial discrimination is being felt across the board for Asian Americans of various diverse backgrounds. Could you please advance the slide? What we're also seeing is an unprecedented increase in mental health needs during this past year. We are seeing that Asian Americans, 4 out of 10 Asian Americans are experiencing depression or anxiety symptoms. 53% are saying that mental health concerns are a top stressor for them, and almost a third would like help accessing mental health services. There certainly are segments of the Asian American population that are more vulnerable. Those who are low income, women, non-binary and trans individuals, and younger adults are reporting more mental health symptoms than those who are older, who are more have higher income, as well as men. And I also want to say that certain ethnic Asian Americans, certain Asian ethnic groups are experiencing more mental health symptoms, including Cambodian Americans. So I see my slides are a little formatted funny, but I'll go ahead and continue. What we know is that racism impacts mental health and well-being. You can think of racism as a chronic and an acute stressor that harms health through taxing or exceeding existing individual and collective resources or threatening well-being. And we know from previous research that racism increases the risk of mental health problems, and it also increases the risk of alcohol and tobacco use. One impact of racism, or one way we can also conceptualize racism, is that it causes psychological and emotional harm. And racial trauma is the term that we've been increasingly using to describe the psychological impact of racism on those who experience it. And this can be felt through symptoms of depression, anxiety, avoidance of the places or people that are attributed to racism incidents, hypervigilance, being more cautious of your surroundings, intrusive thoughts, memories, nightmares, as well as physical reactions. But one thing that's really important to point out is that racial trauma itself is not a mental illness. Even if it is associated or puts people at risk for mental illness, it itself is not a mental illness. It is really a common and understandable reaction to facing racism. we're seeing in our Stop AAPI Hate respondents that people are reacting to the racism they face with these traumatic stress reactions. So we asked participants after the incident what symptoms they were experiencing after reporting to Stop AAPI Hate and recently. And you can see that that racial trauma symptoms are actually quite common and that they have impact immediately after the incident, but also in at least the short term. Interestingly, anger goes up over time for a lot of hate incident victims. Go ahead and advance the slide, please. So to wrap up, and I feel a little disadvantaged not having all of my notes in front of me, but I just wanted to wrap up by saying that we know that there is a lot of stress that Asian Americans are experiencing at this time. We know that stress can lead to an increase in mental health symptoms. We also know that Asian Americans are facing unprecedented racism at this time that is impacting their mental health. And we also know from previous research that mental health has a bidirectional relationship with tobacco use. And we know that racism increases risk too for mental health problems. So I'm excited to hear from my colleague, Dr. Tsoh, about tobacco use at this time and try to make more of these connections. Thanks, and thanks for bearing with me through these technical difficulties.
Thank you, Dr. Tsoh. That was a really powerful presentation and really appreciated providing the new data that you were sharing. And at this time, I would like to turn it over to Dr. Tsoh.
Thank you so much, Rod, and thank you so much, Dr. Tsoh, for the presentation. And today I will also be sharing with you some of the data from this AAPI COVID-19 Needs Assessment Survey, and then some additional data as well. So let me share my screen and hope this time will work. So let me know if that looks okay at your end. Okay, so I will be focusing a little bit more on smoking and specifically sharing with you what I've learned, and then would love to hear from you all as well in terms of what you might have observed and maybe data that you actually have been collecting as well about smoking among Asian Americans during the pandemic time. Very quick overview what I'll be covering. I want to do a disclaimer. It's more like it's going to be a snapshot. Our data that we're going to present, they are preliminary analyses. And also you will see there are just no perfect data. Some of them small, some of them are big, but then, you know, again, there are definitely, we need more data, but let's see how we go, and would like to, you know, looking forward to a great discussion. So just going back, I don't know if you still remember, like a year ago, this is from The Economist, and there were even suggestions or, you know, kind of like a myth in terms of, hey, maybe smokers are actually were protected from getting ill from COVID-19. But soon we see a lot of data. And actually, you could see that from CDC website and among a lot of other studies really showing up and telling us that smoking, in fact, including former smokers, they are at higher risk, particularly current smoking, leading to more severe progression of COVID-19. And since then, lots of efforts going on in the field, leveraging the pandemic. And you know, you would see a lot of this sign within the US and globally, including Quit for COVID in the UK as well. And so now the question is how things have changed, have not changed. this is from the Bloomberg opinion news. From the business end, they said pandemic stress smoking is helping out big tobacco. So this is from the business end, talking about cigarette sales that's been observed. If we take a look at the blue, the light blue, and the dark blue lines, like these are global data that they have collected. And you could see that a lot of countries, basically more cigarettes were consumed than usual, according to these marketing data, okay? With a few exceptions. China was one of them, and Germany, Italy, looks like South Korea, like kind of going both. But if we look at US, we're way up there in terms of cigarettes consumption, according to the sales data. Then, so this is just like published a couple weeks ago, or last week actually. And also recently, we have a very important news that actually got quite a few headlines. In March, the North American Quitline Consortium published a report talking about the impact of COVID-19 pandemic on smoking cessation. So these are Quitline data. Look at the drop in 2020 volume. Though again, it's national data. I know Cherrie later will be sharing with us her like firsthand experience with the Asian smokers Quitlines. Very much looking forward to that. Here, according to the nation, again, it's not focusing on Asians. They're included, but they're not focused on Asian American data at all. But you can see then like a big drop of 27% just within 2020. And what does that mean, or what could it mean? Does it mean that people are smoking more and they're not interested in quitting, or perhaps many of them actually ended up quitting on their own? They didn't need help. What might that mean? So I'm going to like to share with you data from some brand new data, actually from a couple of studies. The first one is a tiny study, is a pilot. It's part of our Healthy Family project. And this sort of among our first launch for the Korean Americans. This is sort of our second phase. So it happened all during COVID time. So our Healthy Family project recruited both smokers and a family member, and in this case could be their friends. And actually we open it up for smokers who would like to participate by himself or herself. So it's a pilot form. It's the first time we're actually doing the lay health worker, like peer-to-peer education through Zoom. But participants did not need to want to quit smoking. In fact, many of them didn't. So this is a small pilot. And from this pilot, we also interviewed them 3 months later. And that mostly took place during the months of October through early December. So that is when we were able to got into some direct COVID related questions, but they started working with us or participating in study during the pandemic already. So we selected 62 participants who have reported using regular cigarettes or e-cigarettes during the past year. So here's what they were sharing with us in terms of the changes in the smoking behavior and vaping during the pandemic. So out of the 62 people, in fact, we have almost more than half, almost 60% of them are dual users. That means they smoke and use both e-cigarettes and regular combustible cigarettes. We only have 5 individuals who only use e-cigs, and actually they participated as a partner of our smoker participant. And then we have the remaining 30% or so who smoked cigarettes only. So you could see, if we take a look at the green first, which is the cigarette use only, and then you will see that it varies. We have people stop smoking, but certainly some of them were assigned to the tobacco curriculum, but everybody actually got tobacco related information. They got the Quitline information and so on. But you could see that a lot of them actually stayed the same. Okay, the purple bars, they are the e-cigarettes use. Interestingly, I had more people sharing with us, seem to be, at least percentage-wise, that they have completely stopped e-cigs. I had to say, as a researcher, we were really thinking about, hey, maybe this would be a time that we see like another wave or rise in e-cig use. But here, it didn't seem to be like, we kind of have a net, like in terms of probably even no change, because we had people use more versus people stay the same and people stop completely. Then we moved on to ask them, well, out of the following factors, tell us if you feel any of these factors might have impacted on your smoking and among other behaviors. So again, bear in mind, this is really tiny samples, okay? But I just hope to share with you as like a hint. So these are all COVID-related data, and then or factors, and we actually asked them about. So I'm only looking at people for those who reported reducing or stopping. So the green would be those who have stopped completely using cigarettes, or those who are, using or reducing. Okay, so I will hurry up a little bit. I see the clock clicking, and then you will see that the factors vary, and certainly shelter in place, social distancing, and health concerns as well. And they're also stress in some way, a small percentage. Here, again, very small sample size here because we did not have a lot of people who reported increased smoking and some increased vaping. But you could see, I just wanted to have your attention paid here is family conflict, stress seem to be at least up there. But once again, sample size is very small. Now, I would like to share with you a much bigger sample that Dr. Tsoh led, and then I had the privilege to join her and other colleagues. And so here we asked about this question out of the 3,700 people, is that what have you done to cope with your stress related to COVID-19 pandemic? And you can see here that people did various things, talking to family, watching TV, eating, exercise, sleeping, drinking, marijuana use, and about 158, a tiny percentage. And of course, many of them were non-smoker. One piece of data we didn't quite have was like a clear kind of tobacco use history. Nonetheless, we got some hints here. So about 4.2% of Asian Americans in our sample said that they used cigarettes or e-cigs to cope with the pandemic. And here we look further, whether discrimination. How has COVID-19 pandemic impacted on your family life? Facing discrimination being checked off, okay? And also the mental health condition. We look at two items. One is any diagnosis, depression, anxiety, PTSD, or other mental health diagnoses that were told by health professionals. So it could be pre-existing condition prior to the pandemic. It could be also during the pandemic, but they checked off as they were told. It's like more like a diagnosis. The other one is that we use the PHQ-4, depression and anxiety symptoms. We're looking at more like current the last 7 days. So quickly, so we did a logistic regression looking at, controlling for Asian ethnicity, age and gender, and survey and so on. So a few things, since we're on the topic about mental health and discrimination. So here is an example where we see for those who reported having elevated symptoms of depression and anxiety, they were twice as likely to have reported using cigarettes or e-cigs to cope with the pandemic. Here are health conditions. You see health conditions a little bit more complicated, but here we compare in terms of those who have no health condition Okay, and then those who have one or more physical but no mental health diagnosis. And here is one or mental health diagnosis but no physical condition. And here are both. Okay, so you can see the sample size a little bit smaller here. And nonetheless, this is a very good sample size here we're looking at. You can see this adjusted odds ratio climbing up in terms of, you could see how this positive relationship with using tobacco to cope. Facing discrimination. We talked about the intersection, discrimination, depression, anxiety, interrelated. Here we're talking about, in this multivariable model, that this is independent of depression and among other factors. Facing discrimination, those who indicated that that was one of the impacts that they faced during COVID-19, they also, once again, a lot more of them actually chose to use tobacco. So just to wrap up here, I think we are seeing a lot of potential implications. No clear, people go both way, increase, decrease. And what are some of the factors? At least from this beginning here, we are starting to see some association, discrimination with discrimination, perception, as well as mental health condition, depression, anxiety symptoms. So thank you all.
Thank you so much, Dr. Tsoh. That was really great, and really looking forward to the conversation about the connections between stress, mental health, and smoking. Again, just a friendly reminder, if you have any questions, please put them in the Q&A box. I'm going to introduce our discussant, Cherrie Ng, who is going to share a little bit about the work that they do at the Asian Smokers Quitline. And then we'll have an open panel to discuss among all three presenters. So let me introduce Ms. Ng. Cherrie Ng is a project manager of the CDC-funded National Asian Smokers Quitline. She's responsible for increasing awareness and publicizing information about Asian Smoker Quitline's valuable multilingual counseling services. She also cultivates new partnerships with healthcare providers and community partners in the US, and shares information about ASQ's services that may be of interest to these groups. So please join me in welcoming Cherrie Ng.
Hello, everyone. Just want to make sure that all of you are able to see my slides. And so basically, these are the brief introductions about our service, Asian Smokers Quitline. We are actually funded by CDC, and we have been in service since 2012. Our service target audiences are Chinese speaking in Cantonese and Mandarin, Korean and Vietnamese. For those people that they are mostly comfortable in speaking in these languages and they are limited in English proficiencies, as long as they are living in the United States. And then when they use our services, then we are able to provide services to them. And it's a free nationwide service. And we are not only providing telephone counseling, but we also have self-help materials. And for some of the eligible tobacco users, when they call us, we can also send them 2 weeks supply of the nicotine patches. Our operations hours is Monday through Friday, 7 a.m. to 9 p.m. Pacific time, or 10 a.m. to midnight the Eastern time. And as you can see on this slide, we do have 3 different language dedicated numbers. The reasons that we are doing this, we wanted to make these entire journey easier and friendlier to our Chinese, Korean, and Vietnamese speaking clients. They do not need to jump through so many hoops, and they can, actually talk to a live agent when they call during the business hours. So that's why we have 3 different numbers according to the different languages. And as you can see, that this is a map to shows you like all the states in the United States. As long as they are living in United States and then they call us, then we can provide our services to them. And as I mentioned earlier, for the medically eligible clients, when they call us, they have to answer a few questions. Those questions is regarding whether they have any medical contraindications, or do they have any like allergic issues to using the patches. And once, you know, they have answered all these questions, and if we have all the green lights, then we will send them that 2-week supply of nicotine patches directly to the mailing address that they are providing. And this is just a snapshot about all of our services that we currently offer. And just started this year, we have launched our text messaging program to support some of the smokers, tobacco users, and they wanted to think about quit smoking, but they still not quite sure what to do, or they have already started quitting, but they wanted to get extra support. So they can text one of these key phrases in languages, in Chinese, Korean, or Vietnamese. Once we received it, then they will receive these interactive message or the supportive message to us, from us, and in that particular language. And besides smoking, we do have quit vaping options that they can also text these key phrases to us, and we can offer the supply. We can offer our support to them. And of course, you know, phone counseling is not only available for smokers or vapers, but we also make it available for our proxy clients. As we know, Asian cultures, a lot of time the smokers may feel embarrassed, or they do not want to call themselves, but a lot of time their family members or friends wanted to help them. They wanted to share advice with them. So we encourage our friends or family members to give ASQ a call, and we can also offer, you know, proxy counseling to give them some ideas what they can do. And they can always go to our website to access all those online resources, and it's also in different languages too. So we are hoping that next year we can have our online chat options available, so we can make sure that more people, they can you know, access to the quit smoking service for free in different platforms. So this is our new look of our free materials page. So I strongly encourage you to come to our AsianSmokersQuitline.org and then to check it out. And there are also some resources, promotional materials for community partners, providers in English and also in the different languages available. So check that out. So before I ended my you know, presentations here, just wanted to remind all of you that May is the Asian American and Native Hawaiian Pacific Islander Heritage Month. And the last day of May, May 31st, is actually the World No Tobacco Day. So I think these are some of the good reasons to encourage our community members to think about to start living a healthier life and stay positive and reach out to you know, some available resources to help them to quit, to stay quit. And these are my informations, and I look forward to you know, working with all of you closely. Thank you very much.
Thank you, Cherrie. And if I could ask Dr. Tsoh and Dr. Tsoh to turn their videos on, and then Cherrie, if you wouldn't mind staying on as well. And again, just a reminder, please submit your questions in the Q&A box. We are going to go a little bit past the top of the hour to allow for a much fuller conversation. But let me start off by thanking our panelists. Thank you, Cherrie, for sharing information about what services Asian Smokers Quitline provides. I'd first like to start with you. If you could share a little bit about what have you been finding in terms of the number of callers, proxy callers to the Quitline since the COVID pandemic began?
Thank you, Rod. And actually, I ran quickly data, and I found that we actually have some increased numbers of calls that are from proxy. So the increase, it's about like, I would say 10% of the calls compared to last year. And but the proportion among all the callers, they are still about the same, like 13% of our all callers or the clients, 13% of all of our callers are proxy clients. They are calling for somebody else. And I have to say that overall, the call volume has been increased in 2020 in all 3 languages lines. And we have more smokers or tobacco users registered for the service and tell us that they are willing to quit smoking. And we also received more proxy callers to call us and ask us, what can I do? Because right now I spend so much time at home with another smokers at the same household. So what we can do. So we do see that there are significant increase of the call volumes and the registers to acquire quit smoking services in 2020 compared to 2019.
Thank you for that. Dr. Tsoh, I wanted to ask you, you talked about several different pandemics. So really the concept of syndemic of both COVID, racism, mental health, and tobacco. Talk a little bit about mental health and with that complexity interaction or the complex interaction of all those, what is kind of the primary recommendations that you have for addressing mental health within that context?
That's a tough question, Rod. So there are lots of really complicated factors happening now. What we can say for sure is that we have not seen this increase in mental health need before. We're seeing, compared to pre-pandemic, the numbers are tough to compare, but pre-pandemic, CDC was reporting that about 10% or less of Asian Americans were experiencing anxiety or depression symptoms. And what I shared with you from our study is that about 40% of Asian Americans in our study are experiencing depression or anxiety symptoms. So that there does seem to be an increase, and we're hearing anecdotally from therapists all across the country of an increase in need for mental health services, month-long wait lists for folks seeking services, and Asian Americans too. So as far as these complicated relationships, it's tough to say, and we don't necessarily want to say that discrimination is going to lead to a huge increase in mental illness among Asian Americans, but certainly discrimination in the context of all of these pandemic stressors is something that we want to pay attention to. We also want to make the connection between stressors and tobacco use, knowing that sometimes people cope in an unhealthy way by using tobacco to cope with stressors. We know from previous research that that those who experience high levels of racial discrimination are more likely to smoke than those who do not. So putting all those things together, I think there's a lot that we need to pay attention to, and a lot more resources that our communities need to tackle discrimination, racism, and tobacco use. And we probably don't want to silo each of those topics, and we want to think, in very complicated ways about how these things might be interrelated.
Yeah, I think the statement you made about not siloing each of these issues is really important. So I want to ask Dr. Tsoh, since you shared some data related to smoking as a coping mechanism, I have 2 related questions. One, is there a possibility in response to that question that they actually don't see smoking as a coping mechanism, but just as a regular habit? And then secondly, how do you begin to address smoking or commercial tobacco use when you have all these other pandemics that are being addressed and maybe being perceived as more important?
Such a good question. I would just share with you like my current thoughts, and I think they could all change as well as we discuss more and more data to come. So I think first of all, I guess the picture here, when you're talking about coping versus people just continue not thinking of it, and that is exactly right on. We work with a lot of smokers. Basically, smoking is such a part of their life for so long. It's not something that they would even be thinking about it. In fact, therapeutically, that's what we want them to be more aware of, actually, to kind of break that automated, like action, to kind of think about, or maybe just a tiny bit of delay, like delay each of your cigarettes and so start, just to even think about it. So I think, Rod, you right on in terms of when we, when we ask that question, like, what do you use to cope, right? It's sort of like what you meant by, I purposely use certain substances or certain, or some people would tell us they exercise, they talk to the friend. So they have some purposeful use of, say, in this case, vaping or tobacco, and where they would have this expectation. This will be something that will help them and so on, versus someone who might just be smoking more, without necessarily realizing. It's just all of a sudden, oh, I need to buy another carton again, or something like that. So I think the notion would be, what I would be actually more interested in is to get at whether the changes in terms of their interest for quitting, for example, what would be the obstacles that they would be seeing. And kind of that would also be leading into your second question in terms of how do we, address with all these complicated factors together. And I feel that one of the things that I am learning from these data, and also from working with some of my own, clients or patients in our outpatient setting, is that the same stress could be perceived as very different to different people. Sometimes it could be very motivating. On the other hand, it could be very damaging. But just like what Dr. Tsoh just mentioned about how important it is that we can no longer treat each of these entities as a silo, as so tobacco is just tobacco, depression is just depression, and now we complicate it by the much higher visibility, and also it's not new, although the pandemic has actually exacerbated a lot, is the discrimination, the perceived discrimination. But what does it mean? And then on the other hand, it would also be bringing opportunities, I think. Perhaps we could engage, I'm coming from a clinician working with smokers. Perhaps we can engage smokers in terms of starting off by, healing, starting off by, working together, to be inclusive, to support each other. A lot of smokers actually have stigma as well. So, related to smoking, and now it's even further exacerbated. So I think this is an opportunity, whether people able to stop because of the pandemic or they smoke more. Either way, we need to continue to provide such support, because I think this is not like a end to it. It's actually more like a beginning to all these changes.
Yeah, the beginning of an opportunity, perhaps. And Cherrie, I want to ask you, since Asian Smokers Quitline has been around for quite some time and has provided a really important service for folks to call in, have you noticed any calls that are either non-tobacco related, such as things around mental health or stress or racism? And if not, do you see a need for perhaps an integrated, line that folks could call to talk about any of the issues that we've been talking about?
Thank you for these questions. Well, yes, we have been around since 2012, and actually, if we counted all those pilot projects and the Asian language projects that was originating from California Smokers Helpline, we actually have been around like almost, or actually 30 years already, since 1993. And the original ideas when we are, thinking about to have a Quitline, of course, it's dealing with the tobacco issues and helping people to quit smoking, as we know that the target audience as we are trying to reach, usually they are coming from other countries to the United States. So the cultures and social norms are quite different than all the people here in the United States. So that's why we wanted to, have a Quitline to help them to kick this habit. And once in a while, we do have, these clients to call our service line because we speak that language and they feel more comfortable to express, other of their concerns or other things that they are hoping that we can help them or refer them to the right place. So it's not only just, the mental health issues, but sometimes it's like low income housing. Where do I get my social welfare and food stamps and things like that? So we got sometimes we have all these kind of calls, and I do feel that, of course, if the funding is available and the resources is available, that would be such a great idea to have different lines to support the people they are limited in English proficiency. But we want to also provide the same opportunity and share the resources that other people that are using right now, but just because of the language barrier, and they may feel, a little bit hesitant to talk or to ask the questions, because in the Asian cultures, a lot of times we are really holding to ourselves. We are just trying to solve our own problems. So I do think that if there is, funding available, then this is such a great idea. As far as I know, like 211 in California, they also have in-language service for some of the Asian groups. And so that's the resources that I know so far. I hope I have answered these questions, but this is my observations and my comments.
Thank you very much. We actually have a couple of questions in the Q&A, so I'm going to go to them. The first is, are there any guesses as to why Chinese or China tobacco sales have drastically dropped, and if there's any public health messaging that is not seen in Western countries? Wondering too if Chinese versus other Asians have a parallel trend here in the United States in tobacco use. Dr. Tsoh, I think that's a question for you.
Yeah, when I look at the data, again, they're pretty new, and it's like marketing data. And so they're sort of, I guess, the source of data and also the way that they analyze it could be different. But one thing that I'm worrying about is how bad China was hit at the beginning. And now, of course, United States, India, and all that. Whether or not the observation for those drop in cigarette sales, from the article itself, they were talking about how remote working would allow people to take more smoking break, and that's why we're seeing a lot of increase in other places. And so one of the things that I'm worrying whether or not such decrease is not necessarily a successful public health, everybody really quit, was it could be a combination of the number of death and situation. And there are also many smokers could be, we do not know for sure the data in terms of how many of them, in fact, that they could be worse off when it comes to COVID-related death. As well. So I really do not know. I would love to hear more, but I think it's something that really worth watching if indeed there, that we are actually seeing a decline. And in terms of in parallel, I think I'd love to hear, both Annie and Cherrie, your experience, if indeed you feel that, Chinese or perhaps other Asian smokers, that if you have observed, actually they're wanting, more desire to quit smoking. From the data that we have seen, we don't necessarily have seen them drop, because I'm seeing people go, both direction. The small data set that I shared, they were the Korean Americans data set. So in some ways, that I I think it will still remain to be seen. I think it's a wonderful question. Love to hear all of your thoughts as well.
Let me ask the follow-up question, and then I think we're going to go to the closing just because of time. This is probably a quick question for you, Dr. Tsoh. Is cigarette use higher than e-cigarette use among Asian Americans?
It still is, but there is always an age factor as well. And, as we know, Asian Americans are not immune. The younger adults are the one, and also we're very, very diverse. We haven't even talked, about, different ethnic groups. So, but by far, right now, in terms of tobacco use, cigarettes remain the highest when compared to other types, including e-cigarettes.
Thank you. So I'm going to ask each of our panelists to give a closing statement, and I'm going to preface it by asking, we know that in some ways, COVID has really only made visible the underlying inequities that existed prior to COVID. And some of them include, smoking and chronic diseases. Some of it includes access to healthcare, racism, as well as some mental health needs. How would you prioritize the next steps to address the intersection of that syndemic of COVID, racism, mental health, and tobacco? What would you prioritize? And are there any examples of policy change or systems change that you think should be at the forefront of what we do? And I'm going to ask Dr. Tsoh to start, please.
Sure. In this work that Dr. Tsoh and I have been doing in the past year that has been very community engaged and on the ground, we've seen our community-based organizations, particularly our Asian American serving ones, step up in ways that go above and beyond what their funding in some cases allows. So I would say what needs to happen is more funding for our Asian American serving organizations who are often on the front lines dealing with folks who want to quit smoking, who have stressors like food insecurity, who are dealing with racism perhaps for the first time. So if there's one thing that we can do, I think it's providing more support for our organizations on the ground.
Thank you. Cherrie, would you like to go next, please?
Sure. So I'm thinking about if the providers, like the health systems or physicians or anyone, they can be more aware that unlanguaged tobacco cessations or tobacco control services available, and they can be more proactive to talk to the patients and refer them to the available in-language programs, either in their county, in their community. That would be so awesome. Maybe if they can, integrate their electronic health system directly to the Quitline or to some other programs, that would make the entire workflow so much easier and so much quicker to connect the tobacco users with the right resources. Thank you.
Wonderful, thank you. Dr. Tsoh?
I wanted to say, I want it all, but if I would like to ask one thing, I really want to advocate for sort of a comprehensive wellness approach to everything that we do. We hear a lot about social determinants of health, social determinants of tobacco use, for example. And don't forget about, and then I think and Rod, especially with AAPI, that you all have done very good work, is prevention. I think the holistic wellness approach is much needed, particularly that's what we've seen. So many gaps get created and also widened during the pandemic. We need to be prepared. We cannot afford to have another one like this.
And I think the extension of what you said around prevention is to include policy change, including policies that provide more resources for communities to address these complex interactions, as well as policies that can protect our communities against, for example, commercial tobacco use. So we have arrived at the end of our webinar. I just first of all wanted to thank our wonderful speakers. They provided a tremendous amount of new research, as well as kind of an overview of services that are available and really talking about how we address this in an integrated approach. I also want to thank our funders, the Centers for Disease Control and Prevention, California Tobacco Control Section or Program, as well as the Robert Wood Johnson Foundation. This is just one of several webinars that we're going to be holding over the next couple of months. So I just want to bring your attention to in June, there is going to be a healing circle that's going to be provided. We are also going to be launching a couple of leadership programs, one in California focused on commercial tobacco control called the Spark Leadership Program. Applications are going to be opening next week, and also a leadership program for getting the COVID vaccine out to Asian American communities. We are particularly looking to recruit young adults to be able to give messages back to communities about the importance of getting the vaccine. So please look forward to those things on our website, www.appealforhealth.org. It is also on our website where this webinar, as well as the PowerPoints, will be posted probably in a couple of weeks. Again, I thank you for joining us today. We look forward to partnering with you on many of the issues that were shared today. And thank you again to all of our amazing presenters. Have a great day, and we will see you shortly. Goodbye.